All right, good morning, good morning, good morning. Let's get started. My name is Liz Cassandra, and I am a UR nurse. And just spend some of the morning with me today. So come on in. Good morning. Happy Thursday. So, what does UR look like? It looks like this. I'm cold. I'm cold nature. Me having a blanket on, me being in my house, and me reviewing charts. So I'm going to get started. Of course, you can look at my screen because it's HIPAA, so you can't do that. Any phone calls I make, I will put you on mute. But yeah, this is what UR looks like. And don't forget that I do have a class coming up March the 7th for $89.99. And if you're a nurse and you're new to UR, it's a perfect class for you. There are 4 tests, and I believe I sent you like a phone script for you to keep. You'll have interview questions for you to keep, and we will discuss everything from insurance plans regarding regarding in network and out of network. We will go over denials and appeals, approvals, documentations, and we will do some case review also. So you get a big, good round up thing regarding UR. So let me get started with my day. I start at 8:30. But with this job, I'm able to get up and my husband took my son to school this morning. And again, so the first thing you do is wrap your head around the case, which you'll learn that in my class too. It is a 2-hour live class from 9 a.m. to 11 a.m. And it's a live class so that way you can ask any questions. But I mean, even in the class, you will be learning documentation. You will submit for documentation also to me. You will receive also a certificate of completion of the course. Now, it doesn't count towards CEUs. That's a lot of the reason why my class is only $89.99. But I respect people hustle, and other classes are like $800, $1,000. I just thought for a 2-hour class that was live, $89.99 was the perfect way to set the payment for the class. Ooh, that name is definitely different. But during the class, you will learn the difference between PPL, HMO, EPO, POS, and indemnity plans also, which are rare. They're like the unicorn of insurance. I put a lot of mascara on today. I can feel it. Now, my specialty is pain management, but in the past, I have done it all. I've done pain management, I've done OT, PT, ST, DME, non emergency transportation, of course, orthopedic, including joint surgery. I'm trying to think about home health, but I didn't do skilled nurse visits. We just weren't able to do that. It's different now. They have providers, actually, or not providers. They have therapists doing speech therapy and physical therapy the majority of the time. And the class is good for if you want to be a case manager too, because again, like I said, we do go over interqual, and we have 3 videos, like to look at the interqual process and how that works. Maybe they give me everything that I don't need. I don't need all that. I spend a lot of my time, great, on the phone. I'm sorry, I don't spend a lot of my time on the phone. I apologize. I spend a lot of my time trying to get clinical from the provider's office. Rather, now we're able to fax and call at this position, which I think is so awesome and great. And see, here's one right here. I don't have everything I need. Just me looking at it, I don't have everything I need. Um, there's a script for that too. How you can call, provide a script on how you can call to request additional clinical. So, so again, I've done it for so long. I know what I'm looking for, and they don't have it. I think that's the most frustrating thing about my job is they don't have the clinical there because it's such an easy approval. I can go to another case and see if they provided it in the past. Let's see. They might have. Okay, that's weird. And then you will have access to me too for like if you need a mock interview, you will have access. I have a phone number that I give out to my students too. Now, pain management is a different type of beast. For pain management, it would take me probably 2 days split into 2 hours. So it'll be 4 hours total for pain management. I would need time because it's definitely different for sure. I love my noisy keyboard. It's so purple and noisy. I just love it. You're going to learn how to read clinical. You're going to learn how to document. In my class, again, it's $89.99, March the 7th from 9 to 11. I love doing UR because it gives me that work-life balance. Like I could tell my boss, hey, I have a doctor's appointment and can I start early or I'm an early person or can I stay late? And most of the time it's not an issue. It hasn't been an issue so far, like ever. It hasn't been an issue ever. And I've done UR for over 10 years. Now my quota is 22 per day. And of course I move a little bit faster when I'm not online, of course. And there you go. That one is done. Okay. Approved. Let's input in my. Now every company has different like applications, I guess. I don't know if that's the right word. And so I won't be showing that part, just the documentation and understanding. Oh, let me put that on. Your job is going to be a lot of documentation. You want to document the medical necessity. You need to prove why you approve something. So that's a lot of what you're going to be doing. I lost my glasses and I don't know where they're at. My other one. They're more comfortable and that's where I can see better at the other one. I keep a like a notepad open regarding all the cases I completed for today. I've done it ever since I've worked. So it's just a habit I do. You don't have to do it this job, but I do it. These glasses suck so much. They're so bad. Boom, boom. Okay. I don't know. I don't know. I'm gonna look at this one. I don't know. Like I said, a lot of time it's just me just calling out for additional clinical. That's the majority of my call outs are me for additional clinical. Mm. My good coffee. Oh, my tablet's usually up here in my cell phone. I mean, it doesn't get any better. And a lot of you are is just paying attention to details. Like this one, so the fax didn't go through, so I have to refax this again because I need additional information from them. So I have to come back and check to make sure it got faxed out. Like I'm supposed to open my phone up every morning. I don't do it. I forget. Blame it on my head and on my heart. I guess is what I was. And please do remember because I don't need to smoke, but nurses do not deny any authorizations. That would be practicing medicine, and we don't do it. I don't know where they got started, but nurses do not deny authorizations. A physician has to do that. Now I'm going through my cases again. because it yesterday. Oh, it might be good. Yesterday, I called for some clinical. They haven't sent it yet. And then, but again, during the class, I will go over documentation. We'll review different insurance plans, HMO, PPO, EPO, POS, indemnity plans. You'll know the difference after the class regarding that. You'll know the difference on what they want during interview. I actually send that to you. Um, some of the questions or what you how you need to prepare for your interview for UR. I also too receive like recruiters will also call me too. And then I'm like, well, I'm not interested. Well, do you know any nurses? So if that's an opportunity it's an opportunity for you to network, but then it's an opportunity too for me to get your name out there so that you can get a position. I don't guarantee a position. It just helps, for me to say, hey, I work with this nurse and she's really great, or him or her, and they're really great, and give the information to the recruiter. So it helps. Because I ain't gonna hold you, it is hard to get a UR job. Like I remember when I went to my interview, I was so nervous and I had to interview with everybody. And it was Miss Teresa. And I remember like after the interview, like she just grabbed my hand and I knew like I had it. I didn't have it at that time because the person who I was supposed to replace, she had a stroke, but she came back. But the interview was so good that Cheryl, she's from Canada, she was my manager or supervisor. She remembered me, and I promise you, within a month, she called me back. Hey, I remember you. Can you come back? And I don't think I had to interview again. I don't think I did, and I got the job, and it totally changed my life. Again, I was working 5 home health jobs, running my car into the ground, but this doing the UR got me the freedom to go to doctor's appointments, not miss important school events for my son. And that's the reason why I do like UR. Nursing could look like a lot of different ways. It really can. It's a great profession. Wait a minute. Hold on. So I pull about 3 to 5 cases every time I pull. I don't pull my entire caseload at one time. I'm on an expedited box, which is another thing. So we'll discuss that too, turnaround time. So we'll talk about turnaround times, how important that is. We'll talk about triaging your cases because that's really important. And any questions that you guys have, just put them down in the chat. And let me see. Oh, I see it. Okay. As you see, I'm on my cell phone. So I was like, does this chat gonna work? It works now, so I'm good. I usually have like I said, my music on or something, or me listening to YouTube. And I am not a RN, I'm an LPN, and I make good money. Um, my first job, I made good money doing UR. My second job, I made damn good money. I made when I left, I was making $86,000 as an LPN. That's a lot of money for LPN. The RNs I know were making 100K. for sure. And I mean, we're doing the same job. There's nothing that I couldn't do. They just had a RN, and which was fine. I don't want to get my RN license right now. I don't want to go into debt. Child, do you not know? I still didn't bring up that phone. I'm bringing it up now. We are not required to be on our phone. There are some jobs that you are doing the phone, and you have to constantly answer. That wouldn't be for me. Mm-mm, 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 mm-mm. Because that means you're tied to the desk. I don't like being tied to the desk. I like to get up freely. Mm-hmm. Now the only thing I don't like is this damn what is it? Jabber? Not Jabber. No, Teams. Hot Pops, that gets on my nerves. Let's make sure the patient's name. So we're gonna go over obviously in my class the patient's name. Okay, the self-insured, they have EPO, which is a big difference. You'll learn the difference in the class. I gotta be on the lookout for something when they have EPO. But we are good to go. Okay. Another thing about doing UR, um, when you can, make sure you copy and paste instead of typing all the time. It will save your hands a lot because my hands cramp up. They tend to cramp up sometimes. Okay. Oh my God, in my other video, that this chair makes so much noise. I didn't know it did. It's so funny. Like it just makes so much noise. Hilarious. And again, I'm always cold. It could be 73 degrees and I'm always cold. So I know what I'm looking for this. They're asking for ESI injection, but I'm looking for the pain. What's their pain level? And that's pain management. Again, I'm not offering that class right now. At the moment, I'm only doing an intro to UR for nurses. I got that part. I got what I need. I'm looking for the pain scale. It's kind of common sense. Like if someone's taking an NSAID, you know they're probably having pain. You're not just taking something just to be taking it. Give me the pain scale. Or if they're taking gabapentin, you know they're having pain. I'm not gonna keep on looking for it. It's kind of doesn't make sense to keep looking for it. Okay. It sucks when your back hurts. I've definitely been there. Okay. And this one is done. So I have everything that I needed for this one, and it's done. I gotta change that. Again, you got it's the details you have to pay attention to. You want to make sure your note is correct. It's always going to be CYA or cover or CYP if you want to say cover your booty. Okay, second case done for the day. Well, actually, third one. Now, how do I don't know. Okay. Before I click off. So again, the class is March the 7th from 9 to 11 o'clock. It is called Intro to UR for Nurses. We will go over insurance types, what's the difference. We will review documentation, cases, interqual. You will receive interview, like a handout to prepare you for your interview, phone etiquette also. So there's a couple of things that we go over. See. The link to join the and yeah, there was another thing. I'm only gonna accept 25 people into the class because I want to make sure that I'm able to give attention, answer all questions for everybody. So it's a limited amount. It's only gonna be 25 people. I think that's enough to where you'll get a good understanding. Uh, Especially if you're paying your money, I want you to get what you pay for. And again, it's only $89.99. Also, too, when you go to my website, it's on my bio. You'll see that it goes to another website called Health Equity Liaison Program. It is my other company, and so I wasn't going to pay again to get that. I don't know how you connect it. So it's not a scam or anything. It's just that I wasn't going to pay when I already have another website. It's going to just take you there and you pay there. You got to work smart, not hard. And yeah, I'm not a rich or wealthy woman. So I hope you come and spend your day with me. I look forward to you learning, and I can learn from you guys too. So again, it's March the 7th from 9 to 11 a.m. And it's a live class where you can ask questions and get a great understanding of UR. And so I hope to see you in my class. See you tomorrow.